Okay, so this is my little short video on my daily pin site cleaning. First off, I've got a sterile tray from a sterile pack, and I am now going to drop some chlorhexidine solution, the 5% alcohol, known as Hydrox Pink as well, into the tray for soaking the swabs. The swabs are called soft soap, and they're used for the cleaning as well as the dressing afterwards. Gloves are new, and they've also been cleaned, sterilised with as well as the kitchen table. The gloves have been done with one of a couple of different cleansers. I've got sanitisers, Pure Cleanse, and one that the district nurses use. Draw out, I think any of them work. The swabs, sorry, the dressings for cleaning are just literally dropped into the solution and jiggled around a little bit, and when it comes to the cleaning they're squeezed out. So I can do this so you can actually see it. You want to be wet, not absolutely dripping, but wet, and then I fold them like that, and I'll show you in the next clip how I actually use them. Right, okay, pin site cleaning continued. That's the swab that dressing that I squeezed out before and then folded over into a long flattish shape. What I'll do now is just show you how I was shown to do it in Derby Hospital while I was in there on one of my clean and healthy pins, which is tricky because it now means I've got to hold the camera while I do it. So we'll see how this pans out. That's my Taylor Spatial Frame, and that's the pin site I'm going to clean at the top there. The way that I was shown to do it was to start with the tip of the dressing and to clean and wipe, and to come around the pin while at the same time pulling the dressing along with me. So as I go round in 360 degrees, I'm not actually using any part of the dressing to clean the same area twice, and I've not got anything at all on that dressing there because, like I say, it is clean and healthy, and that will be repeated on all 11 pin sites that I've got on my frame. Okay, this is like part 2 of my daily pin site cleaning routine. This is actually the morning after, and I'm just about to remove dressings from yesterday just to have a check, make sure everything's clean, and also before I start to clean them using the shower, and also another chlorhexidine solution, which is a slightly different one because it's the 4% version, and it's like a scrub, a wash, which is what they use for washing in just before you go into theatre in hospital. It's actually called a hippie scrub. I'll just show you that. Focus is okay, yeah. And also along with that, and because it's not worth using a second hand one to clean the frame, I'm also using one of those, which is a Asda Smart Price toothbrush. Currently October 2011, 10 pence for 2. Yes, that's 10 pence for 2. There's the other one still in the packet, which just goes to show that it is really not worth taking the risk of using an old second hand one. So you might as well buy new because they're as cheap as chips. Okay, I'm just struggling a little bit to get this off with one hand, but I knew this was going to happen before I started filming. There we go. And hopefully you'll be able to see. I can get my hands out of the way. A couple of quite healthy looking pin sites, as well as an old one, which is the bullet hole there on my leg, which is an old one that's healed up. So now I'm just going to take the other large pin dressing off the side, and hopefully I'll be holding the camera in the right place so you can see. And that is the third large pin site that I have. And then I have 4 of those either side, which are the small ones. Those are actually dressed already partly in the atronum or atronum, depending on how you pronounce it, dressings that are on my skin graft site, and they're partially covered, so they don't actually get dressed up in the same way as those pin sites do there, because those are bare and they're exposed, and they're currently being covered up to keep them clean. So I'm just going to attempt to remove that with one hand, if I can remember where it started. There. Those are actually just wrapped around the pins. I'm going to attempt to demonstrate how I do that after with one hand, which should be quite some fun again. But those are mine now, exposed, clean, dry and healthy looking lower pin sites. See if I can get a shot of those. And now I'll carry on with the cleaning. Right, okay, this is me again, carrying on with the frame cleaning of my Taylor Spatial Frame, because it is important to keep the frame clean as well as your pin sites, as the occupational, sorry, not occupational therapy department, what am I talking about? Basically what they told me is that your frame will also collect dirt, and it does, in just the same way as anything else that you're wearing, really. So like I say, for the sake of 10 pence, as a smart price toothbrush, and of course any leading supermarket brand, doesn't really matter. Nice plug there in case they want to deliver me some free groceries for the plug anytime. Quite literally cleaning every last bit that you can get to of the frame. Inside, you have this outside, underneath, and the front, and the stuff that I'm using to clean, like I said earlier, is called Hippie Scrub. It's the 4% solution. It's a little bit like a shower gel, shampoo, soap, whatever you want to call it. Red, smells quite nice, and it contains a small amount of chlorhexidine alcohol, and is meant to be surgically clean, stay to clean, cleaner. What I will also do, and I've taken off the bandages, I can show you the skin graft and the other pin sites, which I'm sure you'll enjoy. And I'll show you some further pin site cleaning using hippie scrub instead of the chlorhexidine alcohol 5% solution. And now, while I get to these more awkward pins and have to twist my leg around, I'm going to turn the camera off for a minute. Okay, so this is kind of part 3, the way I keep stopping and starting things. I'm just going to take off the last of my dressings that are currently covering the site of my skin graft and muscle graft, transplant graft. Can't remember what the medical term is for it now, but I had a chunk of muscle piped in, which is that rather big lumpy looking thing there that'll look like a lump of beef in a minute. I had an artery, was it a vein? I think it was an artery piped in to cover the missing skin that I lost when my tibia and fibula broke, exited my leg and decided to leave a nice big open wound. And there was also residing in the River Trent when I fell, because I fell into the river, don't ask, and broke my leg, and it took me about 10 minutes to get out because I was on my own, because I was fishing, and that caused complications, and I also lost a chunk of flesh, plus while I was undergoing the operations for debridement, I lost some more little bits of flesh obviously, because there was tissue there that was needing to be removed and little bits of bone that needed to be pared away and everything. So anyway, carrying on with the cleaning. This is I've got 2 different dressings on at the moment, Gelinette to keep everything moist, and Atronum, whichever way you want to pronounce it. That's the 2 Gelinettes off, very sticky. And now the dressings with the controversial name. And yes, it might look a bit odd if you've never seen this before, and absolutely nothing like what you expected a skin graft to look like. But this is a skin graft with the added bonus of what happens when you have some missing skin. Yes, it's meant to look like that, and the colours and everything else are meant to be exactly as they are. It might look absolutely horrendous to some people watching out there, but to me it's absolutely beautiful, because it means I've still got my leg. Oh yes. And now I'm just going to pause while I prepare to clean. Okay, there's no easy way to do this. I'm going to have to do it with one hand holding the camera and one in the bottom of the bath. That is a piece of clean new bandaging that's ever so slightly wet, and that is my hippie scrub chlorhexidine 4% solution, which I'm pouring all over there, and I'm going to saturate the bandage with it and mop up any bits, and that then is going to directly clean, just very very gently, around the skin graft site to clean any surface, we'll call it debris off, muck, gunk, scabs. And also, while I'm there, because it's soapy and very easy to do, very effective, as I found out, but I didn't know, I'm going to clean my pin sites at the same time, just squeezing slightly as I do the pins, so it sort of releases some of the hippie scrub And although probably won't be able to see too well because of the shadow of my head and the camera's light, that is very, very clean. And I do get a little bit of leakage, which is quite normal. Afterwards, see a little, you can see a little bit of a tiny scab just fell away. Then I don't do this every day, it's usually every other day for the full clean with a scrub and everything else, because every day might be a little bit too much just at the moment, and it's meant to be kept just moist with the dressings. So, not wanting to overdo it or underdo it, I prompted for every other day, which the doctors seem happy with, until I'm told different. Now I just need to rinse that. I'm just going to saturate it in some more. Maybe scrub again. And just trying to get some white in there, doing the other pins, just going all the way 360 around each pin, squeeze a little bit at the same time. Like I say, it's a very soft bit of bandage dressing, so it's really soft, it's not irritating at all. I just need to swap hands. And lower pins. Clean the pins as well, don't forget, as well as around them. And then after this, you can turn the shower head on and completely rinse them off, because I've been told that tap water, shower water, although I shouldn't be bathing for long times with the frame and the pins submerged for a long time, they mean washing under the shower, which is quite brief in comparison, is absolutely fine. Just swap again to do that last pin. And there is all my pins and pin sights cleaned. And what I will do now, just before I dress them, is just for the sake of hygiene and good practice, I will wipe them over with a dressing soaked in chlorhexidine before I actually dress them, and hopefully I'll show you that in just a while. And that is about as much as it needs to wash up all your heavy scrub. Obviously I can't do too much because I'm holding the camera, it's going to get steamy. That is roughly about all you need to do. So, switching up again. Okay, this is just a quick after shot just to show you the results of the cleaning. This is the results of 2 months, 10 operations in Derby Royal Hospital, which is an extremely lovely hospital, but I really don't want to go back there if I can help it. And this is also the results of a literal 10-15 minute cleaning session for the frame and my pin sites in the shower, using a little bit of new clean bandage and some heavy scrub. And as you can see, if you're familiar, maybe not so familiar with this if you just started wearing one, that's 11, or is it 7 ready clean pin sites. And now I need to go and dress them. Okay, and now I'm going to attempt to show you how to dress your pins. In this case I'm going to do 2. I've got a soft swab dressing, and I'm currently just off camera unfolding it, finding the longest side, and after completely unfolding it out, and then trying to fold it over and over and over into a long, thin, flat-ish shape, which I'll show you in a minute, which I just slightly stretch. I know you're not going to be able to see all of this, but it's a struggle without a tripod. What I'm going to do on these 2 pins, because they're so close together, is I take my elongated dressing and I can pass that underneath the frame, pull it through, and I do this a few times. These are the big pins at the top, big screw pins that are at the head of the frame. And they're quite close together. And although they can be dressed separately, it's also really easy just to dress them together at the same time. Don't really think it makes any difference. Just trying to manipulate it a little bit so it sits down on the skin. It doesn't want to be pressing too hard on the skin. It doesn't want to be pushing it down and pushing the skin down the pin. It wants just to be, really to be sat on top. And also I've been told when I become weight bearing on this leg, because I'm not at the moment, that I can also then use hairpins to keep the dressings down. For the time being, all I do, if you can see, I hope you can, is just pull the tag end of the dressing. You can pull it underneath. If you can grab a corner, you can tuck a very, very small piece right underneath the bottom of the dressing without it pinching or getting too tight, and that will stay in place all day, absolutely, and it will not come out. If you want, you can put hair clips on the top there and there just to keep them in place, but they don't need to. You can wrap them round loosely if you do them individually and then put a hair clip on, which I can show you. Just normal hair clips. Open it up and there we go. But I don't need to use those, so I'm going to take that off now.